couple of role plays where you may be getting asked some questions that you could answer or pass on to the nutrition team, but probably common questions that you would normally get that you should be able to handle yourself. You've got tons of resources. Remember to check your dashboard. You'll have all the manuals. You will look at all that stuff. So we're going to do a role play. Geeta, are you ready?
Yeah. Do you want me to role play?
Yes,
I'll be the participant. Okay. So basically, I'll be the participant, and I'm going to call on people to answer and support me as a participant. Is that okay? Are we all cool with that? Okay. All right. Okay, let's do this. Let's go to Stephen. Since you've been our #1 smarty pants, okay. He's done a great job in revising. Stephen, my trainer, you're amazing. You're amazing. Is it okay for me to have my coffee this morning?
Of course it's okay for you to have your coffee. However, if you really want to get the full benefit of this cleanse, then maybe it might be an idea to experiment with what it's like to go without coffee and see how you feel, because after a couple of days of not having caffeine in your system, you may feel better or worse for it. I suspect better. So of course you can. You've got to have your journey, you've got to do your thing, but you might want to have a go at trying out going without the coffee.
Awesome. Derek, how many points would you give Stephen out of 3 for that answer?
Out of 10, you mean?
Out of 3.
Out of 3 points.
3 out of 3.
I would say I think you did a great job. The one thing I might say though, because in the cleanse it does state not to have coffee. So right. I do like how you're saying, that it is your choice, which is a good thing to say if somebody was saying I'm having coffee during this cleanse, but sticking to the script, just you would want to say there is no coffee during the cleanse. Just make sure you say that to them. Yeah.
And you can say that because it's actually in the workbook. It's in their documentation. Okay.
Okay. Thank you.
Next question. Let's go to Freddie. Freddie, my amazing trainer, senior leader, can you tell me what's the best water filter that I can use? Can you tell me which one to get? Because you know what? They were just telling, the guy in there just said our water's all crap. Tell me what water filter I can get.
Yeah, I can understand your confusion because there really are so many water filters on the market. And this is for you to do your research and have some fun with that.
Okay, well done. Exactly, right. Okay, next question. Let's go to Mark. Hey, so my amazing trainer, Mark, what supplement should I take?
For this purpose of this cleanse, I would say stick with the menu for the cleanse, and afterwards do your own research and consult a physician if you need to. But for the purpose of this cleanse, stay with the menu.
Okay, awesome, great, well done.
One thing I might add to that, just to be safe, when somebody says that, just a quick tip for everybody, is if somebody were to say, what supplement, or if they say something about I'm taking this supplement, you can say to the person, in the content, it does state not to take any supplements. However, if it's been prescribed by a doctor, definitely take the supplement as directed by your doctor. Just make sure you say that.
Awesome, great, thank you for that clarification. All right, next question. And who am I going to go for? Jill. Okay. So Jill, I'm loving this cleanse. Can I use this for a weight loss program?
That's fantastic, Geeta. I'm so glad to hear that you're loving it, and it sounds like it's really working for you. And I'm guessing that you really want to, let's finish the week and see how you are. But I'm guessing you wouldn't really can take elements of this cleanse as a weight loss way. You wouldn't necessarily continue on with this for kind of weeks on end, but maybe finish the cleanse and see how it is, and then as the week goes on, we will integrate this back into our normal life, and then you'll be able to take the bits that really work for you, which will definitely help reduce weight if that's something that's important for you.
Okay, yeah, because I've got quite a lot to lose. So,
Well,
Derek, you want to add something to that?
I would say, Geeta, this is not a weight loss program. This is a cleanse and detox. Some people may lose weight, some people may not. This is not a weight loss program. This is a cleanse and detoxify, and focused mainly at your liver. So you would want to research and look at other forms of weight loss programs, and always talk to your doctor first.
Awesome. Brilliant. Thank you for that. And thank you, Jill, for attempting to answer that question. Okay, I'm going to do a couple more. Okay, I don't know if you can see me. I'm going to attempt to be 8 months pregnant. Nancy, my amazing trainer, I've been doing this cleanse, okay, and it's on day 3, but I'm getting heartburn. Is that normal?
So there are changes in your diet along with the hormones that are changing in your body during pregnancy. It is a side effect that could possibly happen and a symptom you can experience. And the best thing for you right now, we can refer you to a nutritionist, and also look at what your doctor has recommended for you to best support you during this time. Cleanse and detoxify may not be the best move for you, and speaking to the nutritionist can give you some tips that can use and support you during this time.
Awesome. Derek, do you want to add something there?
Yeah, if
You kind of called
pregnant,
on the nurse. Do you realize you did that?
Wow.
anyone who's pregnant, send them immediately to the nutrition support room.
Yeah,
for sure.
Yeah. And can I just add, and they may not tell you this, but this is not just pregnancy, but anybody on fertility treatments really shouldn't be doing this cleanse. They should be detoxifying while they're on fertility treatments. Okay. So if they do share that with you, you don't tell them they're not supposed to be doing the cleanse. You send them to the nutritionist, and we will talk to them about what they can do instead. Okay. Derek, is there anything else that you think would be good for a role play?
Yeah, there's one really big one.
Okay.
And I'm going to call on, let's see, how about Stephanie? Come on down, Stephanie. All right. So,
Okay.
Hi, Stephanie. I'm doing the cleanse, and I noticed the spinach soup. Can I want to add mushrooms to it. Is that okay?
So I appreciate that you want to add it and maybe change it a little bit, but for the purpose of the cleanse and what we're doing here, I would recommend that you don't do that. Although if you really wanted to add it, we could send you over to the nutritionist and you could talk to her about what you could add to the soup.
Okay. Geeta, do you want to comment on that?
Yeah, okay. So the line that we want to always say to them is stick to the recipe. Okay,
Right.
always stick to the recipe, because we want to make sure the recipes actually have been specifically set up in that way, so they cleanse certain parts of the system in a certain way. So if they start to add other things to it that are not on the cleanse, it becomes a problem. Okay, so the line will always be stick to the recipes. And in fact, in this particular instance, don't send them to the nutritionist unless it's an allergy, it's something that whatever's on the recipe does not suit them. That's when you send, like, medically does not suit them, you send them over to the nutritionist. Okay. So we want them to always refer back to the recipes. I believe they get a copy of the medical medium's book as well. So they've got so many resources there that they can use to modify. If they needed to modify the soup cleanse or the soup or the salad, they've got the modifications written down on the recipes. Anything you want to add there, Derek?
Yeah, just that you guys can help us out, because one of the biggest things is just, you've got a ton of resources. Remember that you guys have the nutrition plan as well. Just stick with it. It lists everything, and it will tell them if there are any alternative options that they can add to it. It will actually list those as well. So if somebody is saying, can I modify this, or can I add this, or would it be okay to eat nuts? All you have to say, if it's not listed on the nutrition plan, then no, you want to stick to the recipe and follow it exactly. And that will stop those questions from coming in.
Yeah.
Okay, great. Thank you.
You send them to the nutritionist when you perceive that there is a problem with that person, i.e. you've seen the red flags, something doesn't look right and you're concerned about them, you send them over to the nutritionist. Okay.
Yeah, so like a itchy throat, swelling, that could mean they have an intolerance or they're having an allergic reaction. So that would be send them to the nutritionist.
Great, awesome. So I hope you all enjoyed that. We are going to hang around for a Q&A. We're going to close. I'm going to hand it over to Mark. We're going to do a close and then a Q&A. I've just stolen everything that you were going to say, Mark, but I'm going to hand it over to Mark.
No. I have more things to say. First of all, give it up for Oscar and Geeta and Derek. Come on, love everybody up. Let's give it up. It's some energy and some fun.